This segment of DelmarvaLife is sponsored by TidalHealth.
Breast health is something so many of us think about, but don't always feel comfortable talking about until a question or a concern or even a diagnosis brings it front and center. And whether it's a routine exam, an unexpected finding, or navigating treatment options, those moments can feel overwhelming. And that's where having the right care team matters. And today we are joined by Dr. Chanel Smith, a breast surgeon with TidalHealth, to help us guide that conversation. Welcome to DelmarvaLife.
Thank you. Thank you.
So let's start off with some of the most common breast concerns patients bring to you and how you help them find the right treatment.
So I would say the most common things are breast pain, nipple discharge, they felt a breast mass, or they went and got a mammogram done and they found some abnormalities on that. So depending upon what the complaint is, so if it's breast pain, then I would send them for imaging, or nipple discharge imaging as well. Breast mass the same. If it's already been imaged and there's an abnormality, then I would send them for biopsy.
Right.
Yes.
And this oftentimes is the start of a journey.
Yes,
and,
absolutely.
And how does TidalHealth support patients through that journey?
So we are a multidisciplinary team, and we pride ourselves on that. There's the breast surgeons, the radiologists, the pathologists, the medical oncologists, and the radiation oncologists, as well as we have oncology social workers. So once you've had the diagnosis, if you're struggling with that, you need some help with dealing with that, then we refer you to those oncology social workers. We also have nurse educators and nurse navigators that help them navigate the process of going to all these different appointments and keeping up with all the different people they have to see.
Right, right. And of course, over the years, there have been so many advancements in breast health and treatment. Is there any in particular that you're most excited about?
I would say the thing I'm most excited about is cryotherapy. It's something that they're exploring now. There's some ongoing trials where currently it's patients who are not suitable surgical candidates, meaning they're not healthy enough to undergo surgical excision, that they're able to get cryotherapy, which is basically they create an ice ball to kill the cancer in the breast instead of them undergoing surgery. So it's a local procedure, meaning that they're just receive a local anesthetic and it's frozen and the cells die. So that's something I'm very excited about. I mean, I like operating, I'm a surgeon, but if there are people who can avoid having surgery, then I'm happy that they're able to do that.
Right, and of course you do have people who do need surgery.
Absolutely,
and that's something
yes.
that I don't think anybody wants to go through.
No.
What advice would you give to them if they're feeling nervous about it to prepare them?
So I always advise my patients to come with someone. Number one, you want to have a supportive network, supportive community during this time. Most of my patients are women, and often women feel like they can do everything themselves, all by themselves. But this is not a time to try to be a superhero in that way. Let other people support you. I also advise that they write down any questions that they have. Because often what happens is when they walk through the door, they don't remember anything that they wanted to ask beforehand. And then when they get home and they're watching TV, they're like, oh, I knew I wanted to ask that. So I say write it down in a notebook, send yourself a text message or a note on your cell phone, and come in with those questions.
Now, if somebody is thinking about a breast exam or a consultation with TidalHealth, what should they know about the care that they're going to receive there?
They should know that they're going to receive top-notch care because, again, we are a multidisciplinary team. We discuss everything. We put all our heads together and make sure that patients are receiving the right treatment. So I think they should understand that even though they're here on the Eastern Shore, they're still going to get great care.
Absolutely. Dr. Chanel Smith with TidalHealth, thank you so much for coming in.
Thank you for having me.